The Ministry of Health is tonight grappling with a shortage of reagents that could easily hamper the fight against COVID-19. The testing hitch has slowed down the mass testing exercise that was rolled out 2 months ago. And Health CAS Rashid Aman says with the shortage, there is a backlog of samples that await processing. Stephen Letor reports.
The COVID-19 curve in Kenya continues to run wild, with the number of infections in the country taking a constant trajectory. In the last 24 hours, 3,043 samples were examined, with 117 turning positive, pushing the country's caseload to 4,373. Nairobi County leads in today's infections, recording 51 cases, dotted across 14 out of its 17 constituencies. Mombasa County has 22 cases today, with Kajiado County reporting 18 COVID-19 cases, mainly from truck drivers at the Namanga border. Kiambu has 6 new cases. Garissa has 5 cases, all from contact tracing inside the Dadaab refugee camp, with Nakuru also recording 5 cases. Machakos 3, Busia, Kericho and Uasin Gishu having 2 cases each, while Wajir has 1 case today.
But by and large now, what we have is a community transmission, which means this is transmission within the country. And really, it actually makes no difference now whether it is an importation or whether it is an internal transmission, because the spread is now well rooted in the community.
But there is a problem. The Health Ministry says laboratories in the country are running low on reagents, triggering a backlog of unprocessed samples, and that could potentially hamper efforts to identify the infected persons in good time and rein in infections. The ministry says the shortage is affecting the targeted mass testing, with the government institutions only capable of handing samples between 2,000 and 3,000 in every 24 hours.
You must understand too that when we do large numbers of testing in the lab, it also stretches our capabilities, because we have only a certain number of equipment and human resources that can do these tests.
Several laboratories have reported delayed results owing to lack of key testing components, leaving the doors open for the virus to spread, since samples that later turn positive could interact with many people before the test results are out. Contact tracing is also a challenge with the Ministry of Health, particularly raising concerns with the inter-county movements of some of the people who turn positive. The ministry is also raising a red flag over testing of food handlers, that the new protocols made it compulsory for all hoteliers to be tested, yet many continue to operate without COVID-free certificates. With the ministry operating under a tight budget, it also admits that health volunteers have not been paid, hindering their ability to assist the already overstretched health system.
We are seeing increasing number of young people congregating in groups and organizing gatherings such as house parties in some of these areas. We caution that this is recipe for disaster, because that is when the virus is spread, when people get together and do not take the necessary measures and cautions that we have been preaching out here.
91 people have recovered today, with 2 deaths reported. Stephen Letor, Citizen TV, Nairobi.